Good day everyone, my name is Pabasan Castillo. So now I'm going to demonstrate the intramuscular administration. So drugs may be given intramuscularly both for prophylactic as well as curative purposes, and the most common medication include antibiotics, vaccine, toxoid, and etc. So now we're going to check the doctor's order to ensure to give the right order to the right patient. Then check the label on the medication carefully against the MER to make sure that the correct medication is being prepared. Check the medicine, then check the label. Then follow the 3 checks for administrating medication. Read the label on the medication when it taken from the medication card, then before withdrawing the medication, and after withdrawing the medication to exactly given to the patient. So now we're going to organize the equipment to save time and effort. So we have alcohol, syringe, ampule, cotton balls, pad, gloves, and assuming for band-aid, then for trash can. So now we're going to preparing the medication for ampules. So first, perform hand hygiene and observe the appropriate infection prevention procedure to deter the spread of microorganisms. So assuming that I'm done performing hand hygiene, so now I'm going to use some alcohol. Then, prepare the medication improved for drug withdrawal. So now we're going to flick the upper stem of the ampule several times with a fingernail. Then, uses an ampule opener or place a piece of sterile gauze or alcohol wipe between your thumb and ampule to neck or around the ampule neck, and break the top by bending it toward you to ensure that the ampule is broken away from you and away from the others. So place the aseptic wipe packet over the top of the ampule before breaking up the top. So first we have to clean the ampule. Then dispose the top of the ampule in the sharp container. Then so now we're going to withdraw the medication. So place the ampule on the flat surface. Then attach the filter needle to the syringe. So I'm done attach the needle to the syringe. Then remove the cap and insert the needle into the center of the ampule, and do not touch the rim of the ampule with a needle tip or shaft. With a single dose ampule, hold the ampule by slightly on its sides if necessary to obtain more than the ordered amount of medication. Then put the trash can. Then adjust the the water, the medicine to the okay. Then close the cup. Then dispose the filter needle by placing in a sharp container. Then, if giving an injection, replace to the filter needle with another needle before giving to the patient, and push the solution to the needle. So I'm done push the needle to the up. Then, so assuming that I have another aspirating needle, so I'm going to attach again. So now I'm done preparing the medication. So now we're going to perform intramuscular injection. So check the MER to check if we have to give the right medication. Then follow the 3 checks for administering medication. Record the level of the medication when it's taken from the medication cart, before, during the medication, and during the and after the during the medication. So now we're going to organize the equipment. So to easily prepare the items. Then perform hand hygiene and observe the appropriate infection prevention procedure, so to deter the spread of microorganisms. So I'm done performing hand washing before I entering the patient room, but I'm using again the alcohol. Then prepare the medication for the ampoule or vial for the drug withdrawal. So provide for client's privacy. So ma'am, i-close na akong door, ma'am, ha. So that to ensure that the patient is to cooperation. Then prepares the client. So ma'am, palihog ko lang ito na Then, prior to performing the procedure, introduce and verifies the client's identity using the agency protocol to establish the rapport. So ma'am, ako din si Professor Castillo, imong students nurse. So nada ko diri kay para maghatag o mag-administer sa mga. So okay lang ba sa mga, ma'am? Pwede lang ko mabalan ang pangalan ni ma'am, edad, and birthday. Okay, salamat. Then, assist the clients to a supine or lateral prone or sitting position depending on the choosing site. So, I'm choose the sitting position. Then, explain the purpose of the medication and how it will help using the language that the client understand. So, ma'am, maghatag og tambal. Kini siya tambal kay antibiotics ni siya. Kini siya para malisin ang atong bacteria sa imo or germs na naadya ron. So, okay lang ba si mo, ma'am? Okay. So, select and locate and cleanse the site. Then, select a site free of skin lesion, tenderness, swelling, hardness, or localized inflammation on one that has not been used frequently. So the client has no lesion. Then if injections are too frequent, alternate sites, avoid using the same site twice in a row. So now we're going to locate the exact site for the injection, then apply the gloves. So now I'm done applying the gloves. So clean the site with an aseptic swab using the circular motion. Then, transfer and holds the swab between the third and fourth fingers using the non-dominant hand, and readiness for the needle. Withdraw or position the swab on each the client in the above level. Then prepare the syringe for the injection. So we're going to remove the needle and discard the contaminating needle. Then inject the medication using the Z-tap technique. Then use the ulnar site of the non-dominant hand to put in the approximately 2.5 rather centimeter in the side. So, holding the syringe with the thumb and forefinger between the skin quickly and smoothly at a 90 angle. Then, hold the barrier of the syringe steadily with your non-dominant hand and aspirants by putting the back of the plunger with your dominant hand. Then, if blood appears in the syringe, withdraw the needle and use another needle. If blood does not appear, inject the medication steadily and slowly while holding the syringe steadily. So, ma'am, magsugod na pag-inject, ma'am, ha? Sige. So, after injection, wait for 10 seconds if using the ventricular site. Then, withdraw the needle smoothly at the same angle of injection. Then, apply gently pressure on the side with dry injection. Then, if necessary, to not massage the area of the injection. If bleeding occurs, apply pressure with a dry sterile gauze until it stops. Then activate the needle suddenly device or discard the uncapped needle and attach syringe into the proper place. Then, remove and discard the gloves and perform hand hygiene. So, assuming that I'm going to wash my hand, then document all the relevant information, the time of administration, drug name, dose, and route of the client's reaction. And that's all. Thank you.